Is it an adrenal fatigue issue, or is it really a blood sugar issue? Is it a PCOS or endometriosis issue, or are we really dealing with, at the root of it, a blood sugar management issue? Is it Alzheimer's or dementia or some other neurodegenerative disease? Or can we trace it back to issues with handling blood sugar and insulin? We know that Alzheimer's and dementia is now being classified as type 3 diabetes because of this very fact. We've seen in the research that those who have hyperglycemia, they have high blood sugar, they have insulin resistance, have a higher likelihood of developing Alzheimer's and neurodegeneration. And it develops, or it promotes, the amyloid plaques in the brain that we see associated with Alzheimer's. So we see this connection. It's not just about, diabetes, hair loss as well, cardiovascular disease, insomnia, sleep issues, anxiety and depression. Even those who have traumatic brain injury, they've had a head trauma. Half of those or more will go on to develop what's known as dysautonomia. And so they'll have areas of their brain where the areas of the brain will degenerate, the areas of the brain that really are responsible for regulating autonomic function. Whenever you have that happen, you have issues with managing cortisol and the balance of cortisol throughout the day, which means you have issues managing blood sugar as well. So there's a lot of threads here, but we can really start to unwind this ball of yarn whenever we start looking at, individually of course, a person's issue specifically with managing their blood sugar. Now, signs and symptoms that this is going on for you. So the first question that is really important to understand and to ask somebody is, how do you feel after eating? This is a really telltale sign. So do you feel extremely tired? You get into this slump, you just need to go lay down after you have a meal? Or do you feel like, I'm back, I'm a little bit more at it now, I feel a little bit more alive after I've had something to eat? Because you're the type that gets really hangry, you get irritable, and just getting a little bit of food, you feel a little bit more alive again. Those are the two differences between really the hypoglycemic response and the insulin resistant response. So over here in the hypo section, we got a person who wakes up extremely tired, fatigued, exhausted. They feel like they didn't sleep at all. They need someone to drag them out of bed. They'll lay there for a couple hours if they can, and they're waking up nauseous. The last thing on their mind is getting something to eat. These people are habitual breakfast skippers. They have no need for breakfast. They're not thinking about it. They don't want it, but they will use some stimulants. These are the people who, they need their cup of coffee, they need their cup of green tea, they need some stimulant to get them going, and they're doing that on an empty stomach because they don't feel great. They don't need any food, they don't want any food. They also wake up completely as if their brain's not working, as if they don't want any interaction with the outside world. They're from the waking dead, and it takes them a few hours to really get into doing life and being a participant of the day. So that is what's going on. And often they will have episodes of brain fog or brain dysfunction, or just this sense of, I can't concentrate, I can't focus, just throughout the day whenever they have drops in blood sugar. And then these people will often have cold hands and feet. They have poor circulation and poor tissue perfusion. So that is something that's happening over here. Now, on the more insulin resistant side of the fence, these people are waking up. They don't feel too terribly rested either, but they're waking up. The sign for them is they'll often complain of joint pain, or they just feel inflamed. They look puffy when they look in the mirror. They just feel stiff. And this is something they'll often tell you about. They need to eat pretty quick on. They're ready to eat, and they're often looking for some carbohydrates. They're ready to eat something right away. And they're craving sugar after a meal. So they have their meal, and then pretty quickly after, they're going, okay, where's dessert? I'm ready for dessert. I need something sweet, because their blood sugar will drop due to this huge surge of insulin. And so then they'll have this hypoglycemic response temporarily. So they're looking for sugar. They're looking for something sweet. And these people have an inability to lose weight. No matter what they're doing, no matter what they try, no matter all the things that they're trying to do, or supplements they're taking, or despite exercising, they seem to have issues losing weight. And then, like I said, these people will complain about, I often hear people tell me that my joints just feel stiff in the morning. My hands particularly just feel stiff. I just don't feel that great in the morning from a musculoskeletal standpoint. I just don't feel great. Also, their hormones will be off. They'll be infertile, or they'll have PCOS. They'll have issues with libido. They'll be missing periods for months on end. So this is something that is really classic when it comes to insulin resistance. So I'm going to break these two down on what you can do for hypoglycemic and what you can do for insulin resistant response. But they both have similar overlays, so hang tight. I'm going to talk about really important factors for both of them, but I'm just going to talk about the differences first. For hypoglycemic pattern people, you want to first work on circadian rhythm work, okay? So that means when you wake up, go outside first thing, open your window, open your door, but really expose your eyeballs to light. This is going to help restore the circadian rhythm, okay? Very important. Better yet, go outside and ground while you're exposing your eyeballs to light. First thing in the morning, high intensity workout, just 5 or 10 minutes. You don't want to overdo this because hypoglycemics tend to not be able to really recover from exercise. So don't overdo it, and don't wait an hour or two. You have to do it within the first few minutes of waking up. Step out of bed and do 5 or so minutes of high intensity exercise. Start eating breakfast again. I know this is going to be difficult for many people. I have many clients, it's like pulling teeth, but you have to start eating something. I'll even have some people put avocado or coconut yogurt next to their bed, so the first thing in the morning they can literally just eat some healthy fats. So really focus on healthy fats, some amino acids, not just eating all carbohydrates, not eating a big bowl of oatmeal or pancakes, or even just, a big bowl of fruit first thing. For this type of pattern, you really want to get those healthy fats in early on to help balance your blood glucose for the remainder of the day. Eat before the crash. People will say, well, how often should I eat? It's always individual. Maybe you need to eat every 3 hours so you don't have that hypoglycemic crash. Maybe it's every 4 hours, maybe it's every 2. You don't want to be eating constantly. You just want to eat before you have that crash. You don't want to be snacking or having these, dried bar snacks or whatever that are, filled with garbage. You want to have a nice, it doesn't have to be complex, but some healthy fats, avocados, coconut-based products, whatever healthy fats, olives, avocado oil, things like these that can be helpful to balance blood sugar. Branched chain amino acids and L-carnitine, very helpful for really using fat as energy and pushing those pathways. And some products that I listed here, there's multiple products on the market, but I really like Apex Energetics. Just as one example, they have a product called protoglycin. This is a general product with some of the botanicals that I mentioned in my post. Apex Glycemovite. And this is a powder. I believe it has pea protein in it, and it also has some branched chain amino acids, some plant sterols. So this is going to be a gentle way to help balance this type of pattern. Now for insulin resistance, you've got to remove sugar. Completely got to remove sugar so you stop having all these insulin surges. Okay, you want to do smaller meals. Typically you'll see people who have this pattern, they're eating a huge dinner. Okay, they're like eating some snacks throughout the day, and then they're having this big meal and they're going to have this big slump. So try to have more portioned, smaller meals. Fasting and getting into a ketogenic diet can be very beneficial for these types of people. Because really we want to burn the fat that's being stored viscerally, and really start engaging that fat burning pathway. And this could be something. Fasting is not going to be great for people over here. They need to do some work first to get things a little bit more stabilized. More intense exercise and weight training. Okay, so they can do high intensity exercise here, but also juggling with some weight training. A lot of these people will tend to just go and walk or do some, moderate cardio or something like that. But really doing a little bit more intense training has been shown to be really helpful for people with insulin resistance. Now, from a supplemental standpoint, berberine has been shown in the research to be really helpful. We're talking like 250 milligrams or so per meal. This is not medical advice. This is just general guidance and what we see in the research that can be helpful. If this is too much for a person, if it drops blood sugar too much, which it can be, it's pretty powerful. Rose hip is a gentler supplement that you can use, 200 milligrams per meal. Apex Energetics has both of these products, I believe, both of these botanicals, but there are many places that you can get them. So this is the differences between the two. Now, for both of these, so many things that overlap and are important for both. Sleep. If you're not getting good sleep, if you're staying up way too late and you're disrupting your sleep, your chances of being able to heal this stuff is very slim to none. Real foods, if you're not eating real foods and you're still eating junk and you're still eating fast food, not going to be able to push the needle here. And you got to be exercising and moving, which we already talked about. Those are like the basics, right? Then additionally, we got to really support transformation in the liver. So liver function is really crucial. All right, so things that support the liver nutritionally from a nutraceutical standpoint and from a botanical standpoint is milk thistle, molybdenum, B vitamins, vitamin C. Panax ginseng has been shown to be really helpful. Glutathione. Now, if you have heavy metal toxicity, and you know you have heavy metal toxicity, you might find that glutathione will stimulate increase in symptoms. So you got to be mindful of that. Just throwing that out there. Ginger is going to be really supportive, and Tudka from Cellcore is going to help promote healthy bile formation and excretion. So that's for liver function. That's just the basics for supporting proper liver function. And of course, there's lots of therapies we can do, like coffee enema, to get that pathway moving even more so. Meal timing is going to be really important. I talked a little bit about this. So you want to be eating the bulk of your calories, or a good portion of your calories, earlier in the day. You don't want to be snacking lightly at the beginning of your day. You've been working, you're expending energy, and then at the end of your day, when it's time to rest and start the process for getting into a parasympathetic and getting into sleep, you're sitting there at 7, 8, 9 p.m. eating a big fat dinner. We want to switch that around. Really great studies show that you could eat the exact same calories, the exact same foods, but whenever you eat them earlier in the day, your body will utilize that energy more effectively and you will burn fat more effectively. So meal timing, very crucial. Microbiome is very important. So we know that the microbiome is really important in metabolism and energy production, and that communication pathway between our gut bugs, our brain, and how we metabolize and utilize energy. So using things like plants, fiber are going to be really huge to feed those bugs, and we're going to have more production of short chain fatty acids, which are very important. You can actually take additional short chain fatty acids. There's a product known as Enterovite from Apex Energetics that I really love. Great product for those who are struggling with their microbiome. So you want to eat plant-based foods, lots of them to help feed your gut microbiota. You want to take short chain fatty acids. You can even take, for those who are struggling with this currently, a fiber supplement in addition to, as a training wheel, so to speak. So Fibromin from Apex. I also really like Gastrofiber, I believe it's called, from Standard Process. That's actually one of my favorites to use, and taking that with every meal to start balance some of this blood sugar out. Antioxidants are always a good idea. Resveratrol, like over 1,000 milligrams per day, generally speaking here. Make sure you work with someone. Turmeric, again, a few teaspoons of turmeric per day, very helpful. And then these long chain fatty acids, omega-3 fatty acids, are really helpful, and taking higher doses of these will also really play a role in the anti-inflammatory effects as well. Plus, we need these fatty acids for brain health, for hormone health, and also for metabolism as well.